Assalamualaikum warahmatullahi wabarakatuh. Good evening everyone. Welcome to my presentation. First of all, I'd like to thank all of you for coming here today. Let me introduce myself first. My name is Dede Rahmawati. I'm delighted to be here today to tell you about malaria. First, I will start by explaining to you about what is malaria, how is malaria transmitted, and then I will explain which are the symptoms caused by malaria. It's so important for us. Finally, you will know how to prevent and cure the malaria. These presentations will take about 10 minutes. There will be a questions and answer sessions after my presentations. Thus, if you have a questions, please leave them until the end of the presentations. So, let me start this presentation by explain about what is malaria. Malaria is a disease caused by the Plasmodium parasite, which is transmitted through infected mosquito bites. Once in the body, the parasite multiplies in the liver before infecting red blood cells. Next, I will explain about how is malaria transmitted. Malaria is transmitted by the female Anopheles mosquito, which is infected after biting an infected person. As malaria parasite is found in red blood cells, it can also be transmitted through organ transplant, blood transfusions, and sharing of needles and syringes. The pictures we can see the malaria transmission cycle. Okay, now let's move on the next section, which is about which are the symptoms caused by malaria. Some symptoms include fever and headache, constant chills, fever, sweat, muscle ache, and a headache that you get every few days. There can also be vomiting, diarrhea, coughing, and discolored skin and eyes. People with falciparum malaria can develop bleeding problems, shock, kidney and liver failure, central nervous system problems, coma, and die. And then, in this section, I'm going to show you how to prevent malaria. People try to prevent getting malaria by putting up bed nets so that the mosquito can bite them during the night, using repellents and wearing protective clothing. Okay, now I will give you the information about where do we find malaria. The current distributions of malaria in the world is shown on this map. Malaria is found in more than 100 countries, mainly in tropical regions of the world, but malaria is not found in the UK. It may be diagnosed in travelers who return to the UK from these areas. And then I have a question. Who currently suffers from the disease? Well, it is widespread in tropical and subtropical regions, including much of Africa, Asia, and America, but mainly it is the poorer countries that suffer disease because they can afford the simple protections and cure for the disease. It then becomes serious because they don't have doctors to monitor it and innocent people die because they don't have money. Okay, next. We know that malaria is a serious tropical disease spread by mosquitoes. If it isn't diagnosed and treated promptly, it can be fatal. Does anyone here know how can we cure or avoid the malaria? There are ways to treat malaria, such as the first, using antimalarial drugs and medications, And two, sometimes people have to be monitored in the intensive care unit of a hospital in the first few days of treatment. And three, in case of pregnant women, chloroquine is usually used for treating malaria, and the last is vaccine. Okay, the next, this is information for us. Babies, children, and pregnant females, along with patients with not immunizations, are at higher risk for worse illness when infected with malaria. To reduce the chance of getting malaria, people should avoid malaria-known areas, use insect repellents, cover exposed skins, and use netting when sleeping. Most patients recover with no problems, unless infected with P. falciparum or P. knowlesi, which may have poor outcome unless treated immediately. Babies and children under 5 years of age, pregnant females, and those with poor immune systems frequently have a poor recovery unless treated early in the infection. Okay, in conclusion, malaria is a widespread disease affecting more people daily, so everyone needs to protect themselves. Scientists are looking for a cure, but there is not one yet found. There are people out there giving money to those foundations whose main purpose is to help those affected with the disease. For those people out there infected by malaria, don't give up because help is on the way. Okay, next we can see this is short of my presentations. Okay, this is the end of our presentations. Thanks for your listening, and I hope this presentation has given you new information about malaria disease. Thank you, and Assalamualaikum warahmatullahi wabarakatuh.